To start off, you're going to set up your tray and operatory. You want to prepare all the instruments, burrs that you would need for an anterior composite restoration. You're also going to set up your high-speed and low-speed handpieces. Your dental dam material and armamentarium will also be required for this procedure. The curing light with protective shield is also very important in this procedure. Then the assistant will inform the operator regarding the health history and treatment plan. The assistant will then transfer the mouth mirror and explorer. Air is used to dry the tooth and mirror. The assistant transfers gauze and a cotton tip applicator with topical anesthetic. The assistant then transfers the syringe and observes the patient for any unusual reactions. The assistant then retrieves the syringe and rinses the patient's mouth and recaps the syringe safely. Next, the shade is selected of the composite. After that, the dental dam is placed. The assistant transfers a mouth mirror. The operator retrieves the high-speed handpiece with a tapered Fisher burr in place. The assistant maintains the operating field and thoroughly rinses and dries the preparation. The operator retrieves the low-speed handpiece with a round burr in place. The assistant maintains a clear preparation by using intermittent puffs of air. Next, the assistant transfers the appropriate instruments, starting with the spoon excavator. Then the assistant will transfer the hoe. Next is the angle former. After that is the Wiedelstadt chisel. The assistant cleans and dries the preparation. It's also optional that a liner may be placed in a deep prep. Next, it is time for the application of the etch and bond. Always follow the manufacturer's instructions. The assistant transfers or places the matrix, mylar strips, and the etchant. The etchant is timed, rinsed, and dried according to manufacturer's directions. A second matrix, mylar strip, and wedge is transferred. The primer and bonding resin is applied and light cured. The assistant transfers the composite material and a composite placing instrument. The matrix is held tightly around the tooth and the composite material is light cured. The protective shield is utilized. It's time to finish the restoration. The assistant transfers the forceps to remove the matrix, mylar strips, and wedge. The assistant transfers the interproximal knife. Next is the explorer, followed by the finishing strips. The assistant prepares the low-speed handpiece with a mounted disc to polish the restoration. The assistant transfers the explorer for a final check, then dental floss to check the interproximal area. The assistant transfers the scissors, then the forceps, and immediately retrieves the HVE to suction patient's mouth during removal of dental dam. Assistant also retrieves the dental dam frame, clamps, scissors, and forceps back from the operator. The patient's mouth is immediately rinsed and dried. If necessary, the articulating paper is transferred and the operator checks the occlusion. Adjustments are made as necessary with the appropriate burrs, abrasive disc, finishing, or diamond burrs. The assistant rinses and dries the oral cavity, gives post-op instructions, and dismisses the patient. The patient chart is completed and the op is prepared for the next patient.